talking to a student from Exeter University at the moment. I'll let her introduce herself.
Yep, I'm Rianne Keys. I'm a third year student nurse at the University of Exeter.
Fantastic. And you've had your placement recently at Coleridge Medical Centre.
Yes, primary care in a GP surgery, which was amazing.
Fantastic. So how did you feel about being allocated a primary care placement? Was it something that you were particularly requested?
So in our first year, we were meant to have spokes, but because of COVID, they didn't happen, and it was meant to be GP surgery. And I wanted the 2-week experience. But then I was placed on it for a 7-week big slot of placement hours. So I was a bit apprehensive at first, just
Mm.
because I didn't think that they did a lot. So I didn't think I'd have a lot of learning opportunities, but I was completely wrong, and it was an amazing experience, and it's just opened my eyes into primary care and being a nurse, a practice nurse.
Fantastic. Yeah, it sounds from when I spoke to the practice that you were kept very busy.
Yes, I was.
Um, so what were some of the highlights of your placement in the surgery then?
I got a lot of cross-field experience and interprofessional working. I kind of wanted the full experience. So I wanted to work with every single one of like different employees at the GP surgery. So I worked with the receptionists, I worked with the doctors, the physios, and mental health nurses. Worked with every single one of them just because I wanted to really embrace the field of GP work. And like as a nurse, I wanted to understand it from a patient's perspective as well. I found that really, really interesting, especially receptionists, because I have my own GP surgery, so I see it from a patient's perspective, and it just opened your eyes to the amount that they actually do. And
Mm.
yeah, it was a really, really good experience. And then as a practice nurse, I got to see kind of the amount that they do as well, because I was quite naive, so I thought it was just IMS and smears, but it's not. You can specialize, you could do respiratory and do COPD, asthma. They do a lot of long-term conditions, um, learning disabilities. It's just a huge variety. And as well, I thought practice nurse is where you could go, but you could progress further and be an advanced nurse practitioner. So I got to work alongside them. It was just really good. It was an amazing, amazing placement.
Fantastic. And so do you have any advice for other students who might be allocated a primary care placement?
I'd say really immerse yourself in it and take every learning opportunity you can, and just not be afraid to do the skills and practice your skills in there. I got to do a lot of venipunctures. I got to take lead on a lot of the clinics as well and speak to patients and educate them. It was really, really good.
And the surgery spoke about how you visited the surgery before your placement, which seemed to really help. Can you tell us a little bit about that?
Yeah, so before my placement, I got to do a walk around. So I got to meet all of the different employees there. I got to meet with the managers there. Um, and just get a feel for where I'd be, what we could achieve there. It really settled me in and made my nerves
Mm.
reduce. Yeah, it was good.
And was that something that you kind of initiated yourself, or with the
Yes.
university? Yeah,
Yeah,
so you
so
got
I
recommendations.
initiated it, spoke to my academic assessor, who also said it was a good idea to do. So yeah, I'd definitely say, especially if you feel really nervous, because it
Yeah.
just alleviates all of that and makes you feel ready for the day, the Monday where you start.
Fantastic. Um, and is there anything that didn't go quite so well with the placement, or anything that you would have maybe done differently or wanted
I
done differently?
I don't think that I don't think there was anything that didn't go well. I feel like I got what I wanted to out of the placement. I set like a list of what I wanted to achieve there, and it
Okay.
kind of exceeded my expectations, which was really good. I There were times where I was nervous, and the nurses really took me under their wing, and I learned a lot as well. So having that feedback really improved my practice and my future practice. So there were times where I maybe didn't like get the right vein, and where I feel like it didn't go well, but we'd discuss it and reflect it afterwards, and it was really good. I feel like I'm a pro now at venipuncture and communication. So yeah, it was really good.
Fantastic. And I suppose rather than sort of being in a hospital setting, you had a lot more one-to-one time with certain nurses, which would have been quite beneficial, I guess.
Yeah, really, really beneficial because, like I said, after we could reflect on kind of what we did, what I felt went well, what they feel I did well, and what I could improve on, which again really just helped with my um like progressing as a nurse, future
Fantastic.
nurse.
So how do you think this experience will impact or influence your future practice and your future career path?
I feel like it's definitely impacted it positively. I now feel like I have a better understanding of primary care and like what you can achieve as a nurse. It can open a lot more doors, and it is forever progressing, I think, as well. There are always new roles. Um, I definitely want to go into primary care now after that placement.
Oh, that's good.
It's just having that community as well. Yeah, just the staff were lovely, everyone was lovely. I learned a lot of new skills, and I learned a lot of new techniques, which I don't think you would have done, because in a acute setting it's very like really fast paced and quick, and you
Mm,
don't sometimes get the time to spend. But yeah, it was very good because they shared with me their techniques, and then I can now take them forwards in my practice as a future nurse.
fantastic. Oh, I'm so glad it was a really good experience. The
It was very good.
the surgery were also really highly praising of you as a student getting stuck in and helping out. So that's great. Fantastic. Well, thank you so much for talking to me.
Thank you.
And good luck with your future career.
Thank you. Thank you.